For having me here today. I hope that my slide deck is showing up correctly here. Um, if it's not, definitely let me know. I've allotted plenty of time for questions, so if there's any questions that come up during the talk, certainly feel free to just interrupt me. I'm relatively informal, or raise your hand. So today we'll be talking about early onset Alzheimer's disease and whether it is an extreme enrichment of late onset Alzheimer's polygenic risk. So let me go to the next slide here. Okay. So early onset Alzheimer's disease, what do we even mean by that? Early onset Alzheimer's is a form of Alzheimer's that is arbitrarily defined as when the symptoms due to Alzheimer's start prior to age 65. So this is essentially a young onset form of Alzheimer's disease. And this is a minority of the total Alzheimer's disease population. So only about 5 to 10% of the total Alzheimer's disease population has this young onset subtype of Alzheimer's disease. One other thing I'd like to highlight is that young onset Alzheimer's disease has unique clinical features compared to late onset Alzheimer's. And there's, of course, many investigators contributing to this space. I would like to highlight some of the work by Zachary Miller and Gil Rabinovich, both out of University of California, San Francisco. And what they found is that early onset Alzheimer's has a higher prevalence of learning disabilities, seizures, autoimmune conditions, migraine headaches, left-handedness, higher rates of affected first-degree relatives, more amyloid and tau deposition in the brain, increased neuropsychiatric symptoms, especially psychotic symptoms. They have faster disease progression, and there's much more likelihood of atypical presentations. So whereas late onset Alzheimer's is predominantly a memory disorder, in early onset Alzheimer's, you can have predominant language presentations, predominant visual spatial presentations, or predominant presentations that involve frontal lobe dysfunction. What about the genetics of early onset Alzheimer's? What do we know about that? We know that it is almost entirely a genetically driven disease. And one of the pioneers in this area is Thomas Wingo out of Emory University, finding that 92 to 100% of early onset Alzheimer's is heritable. However, we only can identify a mutation in about 5 to 10% of early onset Alzheimer's disease patients. And these are mutations in the canonical Alzheimer's disease pathway, such as amyloid precursor protein or in the presenilins. In other words, about 90 to 95% of early onset Alzheimer's disease, we cannot find the genetic cause. What about late onset Alzheimer's disease? What do we know about that from a genetic perspective? We know that a substantial contribution, genetically speaking, is from polygenic risk. And what do we mean by polygenic risk? This is when small effect size single nucleotide polymorphisms can cumulatively increase the risk of disease. So just highlighting two of these, ApoE actually plays a relatively large effect size in increasing the risk for late onset, but these other single nucleotide polymorphisms individually play a quite small role. But let's say a patient has a dozen of these relatively small risk single nucleotide polymorphisms, that cumulative risk may actually be quite large and can significantly influence the genetic risk of developing late onset Alzheimer's. So that's what we mean when we say polygenic risk, is that there's many different genes that together can increase the risk of disease. And this work I'm highlighting is from Jennifer Yokoyama out of UCSF and Rahul Desikan also out of UCSF. But of course, there's many different investigators contributing important work to this space. And there are also different types of polygenic risk scores out there for late onset Alzheimer's. This is definitely an active area of investigation. Another thing about polygenic risk in late onset Alzheimer's is that it influences the chances of a patient having Alzheimer's for a given age. So just looking at this particular graph here, if you're 80 years old and you're in the lowest quartile of risk bracket, you have an 80% chance of being cognitively normal. But if you have the highest quartile polygenic risk, you have about a 20% chance of being cognitively normal. So big differences in how likely someone is for a given age to have Alzheimer's depending on your polygenic risk. So in the paper that we published, we asked the question, is early onset Alzheimer's caused by an extreme enrichment of the polygenic risk of late onset Alzheimer's disease? And for this study, we included 193 participants with early onset Alzheimer's who did not have a mutation in amyloid precursor protein presenilin 1 or 2. We included 179 late onset Alzheimer's disease participants and 70 controls. And what we found is that early onset Alzheimer's has the same polygenic risk as late onset Alzheimer's. It did not have more polygenic risk as we may have expected. Furthermore, late onset Alzheimer's polygenic risk did not predict the age of onset of early onset Alzheimer's disease. And this is just graphically shown here from our study data, showing that as a patient had more polygenic risk, we may have expected them to have an earlier age of onset, which is what happens in late onset Alzheimer's. But in early onset Alzheimer's, there's no relationship between the polygenic risk of late onset Alzheimer's and the age of onset of early onset Alzheimer's disease. This implies that early onset Alzheimer's disease has a unique genetic architecture compared to late onset Alzheimer's disease. And these genetic differences parallel the clinical differences between early and late onset Alzheimer's. And this also implies that there are undiscovered genetic contributions to early onset Alzheimer's disease. This work parallels other investigators that are looking at this question in the field. This is Jonathan Schott out of University of College London, and he examined a visual spatial variant of Alzheimer's disease called posterior cortical atrophy. And this particular variant of Alzheimer's is primarily found in early onset Alzheimer's disease patients. And he found that there was some overlap in the polygenic risk between posterior cortical atrophy and the memory predominant Alzheimer's. But he also found that posterior cortical atrophy could not be explained solely based on the polygenic risk of late onset Alzheimer's, and that there was unique genetic risk variants that were in the posterior cortical atrophy group that were not in the late onset Alzheimer's group. And then this is Rita Kakas, who's another investigator in the genetics of Alzheimer's space. Again, many investigators in this very active area of research. And in a nicely worded review article, she recapitulated some of the newest discoveries, in particular finding that thanks to next generation sequencing, we're finding rare autosomal dominant mutations in non-canonical pathways. So for instance, SORL1 is implicated in the lysosomal trafficking system, TREM2 implicated in immunity, and ABCA7 implicated in lipid homeostasis. Also finding that novel autosomal recessive mutations in these canonical Alzheimer's disease pathways, such as recessive mutations in amyloid precursor protein or in the presenilin 1 or 2 genes. And then finally, epigenetic changes, which we're understanding more and more about, that can influence the development of early onset Alzheimer's. So thanks to novel genetic techniques, we are starting to understand more about the hidden genetic contributions of early onset Alzheimer's. So a summary is that early onset Alzheimer's is almost entirely heritable, but we only know currently about 5 to 10% of the genetics of early onset Alzheimer's. Hopefully this will increase as we have new genetic technologies at our fingertips. There is some genetic overlap between early and late onset Alzheimer's. However, early onset Alzheimer's is not simply due to an extreme enrichment of late onset Alzheimer's polygenic risk. Undiscovered genetic risk factors for early onset Alzheimer's exist, which are being found, again, thanks to these novel genetic sequencing technologies. And then finally, uncovering the genetics of early onset Alzheimer's will help us understand the disease and help us find drug targets. That is it. I want to thank my collaborators and mentors and funding sources. And if you have any questions, please feel free to ask. And thank you very much for having me. I hope you all are having a great conference.